We know that during the festive seasons, many of the known mitigation measures against the virus, such as social distancing, can easily get overlooked as people make merry. It's a time for people to hug, shake hands, and hold each other as they connect, thereby making nonsense of the critical social distancing, masking up, and washing hand principles. In the rest of the world, measures being considered in some of the countries include lockdown in Austria, and for those who aren't fully vaccinated, and restrictions on the conferences and events in China's capital city of Beijing, and total lockdowns in the Netherlands. Media reports indicate that starting tomorrow, Slovakia is banning people who haven't been vaccinated from all non-essential stores and shopping malls. They will also not be allowed to attend any public event or gathering, and will be required to test twice a week just to go to work. We must take note not to have to go the same way as well. It's becoming increasingly apparent that as countries battle the pandemic, a lot more emphasis is being placed on the need to have more people vaccinated. Vaccination is a critical pillar in the control of the pandemic as a long-term solution to prevention of severe cases of the disease, deaths, and enabler to return to normalcy. We know that in most countries, including our own, most of the people who are hospitalized are those who are not vaccinated. In our case, for instance, over 95% of those people who are hospitalized are unvaccinated, meaning that those vaccinated stand a better chance of fighting and avoiding severe disease. Reduced infection rates and increased vaccinations are two important ingredients in the continued opening of our economy. Indeed, we have noticed that over the last weeks, since the lifting of curfew and the revision of several of the other containment measures, the economy has been on an upward trajectory with very good signs of full recovery. We are largely a service economy, dependent a lot on people-to-people interactions, hence the need to ensure the interactions remain safe. As you might be aware, we have been traveling in the last couple of days in several countries, and we have observed an increase in trends towards heightening vaccination efforts in many countries. We have started seeing more and more countries requiring people visiting to not only have COVID-19 negative tests, but also show proof of being vaccinated, not partially, but rather fully vaccinated. It's very important then that we are not left behind in this new world order, especially because we are a tourism destination of choice to many people around the world. We need to demonstrate to the world that we stand in solidarity in the use of vaccines as a mitigation tool against COVID-19 as we welcome visitors to our parks, beaches, and hotels. It is worth noting that COVID-19 vaccination program continues to make good and steady progress towards our herd immunity goal and coverage targets. I'm pleased to note that we have so far received some 10.7 million COVID-19 vaccine doses and administered some 6.4 million vaccinations. I'm happy to report that among our priority groups, 88% of our health workers and 79% of our teachers are now fully vaccinated. We are, however, concerned that only 18% of the elderly population is fully vaccinated, and that vaccine uptake has generally been slow in some counties following the lifting of the curfew last month. We are particularly concerned that low uptake of our COVID-19 vaccines in high counties, in some counties of high population densities, such as Siaya, Meru, Bungoma, Busia, Migori, Kakamega, and Homa Bay, where full vaccination status is still below 5%. Let me remind Kenyans that our overall goal of achieving herd immunity is vaccinating 30 million Kenyans before the end of next year. This means that beyond our adult population, we must also vaccinate some young people who, in most cases, though not bearing the burden of the disease, are carriers, and some of them are also spreaders. As such, it is important to get them vaccinated to reduce their chances of transmitting the virus. We are in a good place now to consider extending vaccination to this group, because in addition to the 10.7 million doses that we have so far received, we are scheduled to receive another 8 million doses of various vaccines. Together with this marked improvement of our vaccine supply, the Pharmacy and Poisons Board has reviewed and given emergency use authorization for the administration of Pfizer vaccines for persons 12 years of age and above, as recommended by the World Health Organization. We are expecting some 4 million doses of this vaccine, which will be administered to even younger people. The global consensus is that convincing as many people as possible to get vaccinated should be a top priority for all nations. Following a review of the prevailing situation in the country and consultations with our epidemiologists, the National Emergency Response Committee, as well as Ministry of Health technical advisors, and as pronounced by His Excellency the President in his Mashujaa Day address to the country, and taking into account the very critical need of ensuring the country remains on track in the containment of the disease, the following strategies are proposed for implementation. Number one, everybody seeking in-person government services should be fully vaccinated and proof of vaccination availed by December 21st, 2021. Such service will include but not limited to KRA services, education, immigration services, hospital and prison visitation, NTSA, and port services, among others. In order to accelerate the vaccination, the ministry, in collaboration with county governments and other stakeholders, will be undertaking a 10-day mass vaccination exercise from November 26th with the aim of administering adequate vaccines as well as to as many people as possible. Number two, counties should A, take up testing at facilities by increasing the capacity of clinicians to detect and test those at present with any symptoms. Number B, ramp up vaccination by integrating COVID-19 vaccination activities into routine clinical services and public health services, such as during ward rounds, routine and special clinics. C, continue providing water and soap for use at public places for hand washing and sanitization. And D, provide vaccination services through outreach during market days, days of worship, and other approved occasions and events. Number three, when seeking transport services, clients should A, show proof of vaccination when using domestic flights. B, show proof of vaccination before use of train services, that is SGR. C, show proof of vaccination before boarding buses, matatus, and all regional travelers. D, all motorable operators, that is drivers, conductors, border riders, pilots, air hostesses, and all other working in the sector should be fully vaccinated and carry proof of vaccination at all times. All these measures in the sector are to be coordinated by the ministries concerned, and we are in consultation with each ministry concerned. As you can see, CS Balala is here today for the area of tourism. I'm in contact with the CS for transport, CS Macharia, as well as the other people who are involved in the transport sector. The Matatu Owners Association, the Boda Boda Association, as you're aware, we have been carrying out programs for vaccination in all those areas. And therefore, we are involving all stakeholders in this exercise. It is not a standalone institutions. We are also appealing to the Interfaith Council to meet and address this matter in their own way, in a manner that we have asked them to coordinate so that they can also form an integral part in this exercise. In public spaces, for example, you must show proof of vaccination for admission into national parks and game reserves, hotels, bars, and restaurants. All businesses, including small and medium enterprises, serving 50 or more people a day, to put up signage requiring proof of vaccination before entry into their premises, and their patrons to be fully vaccinated. As I said, we are also working with the Interfaith Council, and we are appealing to them to adopt measures of a similar nature for people to go to the similar places. The Interfaith Council will meet to give further directions on that issue. For those traveling, therefore, during this festive season, it is good to be wary of symptoms related to COVID-19 and seek medical care immediately to protect one and their loved ones. Visitors, tourists, travelers from European region must be fully vaccinated and provide proof of vaccination before entry into Kenya. In view of the emergency use authorization by the PPB and following the World Health Organization recommendation, I direct that we open vaccination of young people with Pfizer from Tuesday the 23rd of November, lowering the applicable age to 15 years and above. The estimated population in this group is approximately 5.7 million. Finally, all Kenyans are advised to continue to strictly adhere to the regular public health and social measures, including proper use of face masks, social distancing, hand washing, or use of hand sanitizers at all times. Before I go any further into the remarks that we want to make, I want to give a chance to my brother CS Balala to also weigh in on this issue.
We have been consulting on the issue of admission in the hospitality industry, the tourism industry, and the travel industry, of how do we admit people and confirm they're healthy. The first thing we want to welcome is that all facilities, both hospitality and travel, will require every person entering, being admitted, to have fully vaccinated certificates. And they're all digital, so it's easy to recognize. All national parks and protected areas will also demand the same from the 21st of December. This is why what we are doing today is we want to control the spread of the pandemic, because it's going to be a festive season. We are going to celebrate, we are going to enjoy ourselves, but we need to enjoy ourselves while we are safe as well. So this consultation has been there in the last 1 month. We have seen what is happening in Europe and in America, and that's why we want to be compliant with the international community so that we have a safe population. We are also discussing with the minister here, when you are fully vaccinated, you are much safer. And at the later stage, we will review on the issue of requirement of PCR testing, especially for travelers. These are the things we'll review at a later date, but now we want to welcome the pronouncement of requiring all facilities to demand four vaccination certificates. And if you fail, there'll be penalty on the facility and penalty on the individuals. And we'll monitor that. Thank you very much, Waziri.
Asanteni sana. Vile tumesema ni